Hello again, it's Mrs. Toombs. You have probably met me in person at orientation, and I am also the one who did our voiceover of the course syllabus. I'm here today to talk to you about understanding conceptual learning. So the point of today's presentation is to explain the idea of conceptual learning, which focuses on understanding broader ideas and principles rather than memorizing isolated facts. Conceptual learning helps us connect new information to what we already know, making knowledge more meaningful and easier to apply in different contexts, which is important in nursing. It sets the foundation for deeper comprehension and critical thinking. We're going to start with a little activity, and we'll actually probably do this together in class too if it doesn't work for you guys in the PowerPoint here today. But we're going to pretend that we don't know anything about these dogs we're about to see. We don't know what breeds they are. We don't know what kind of dogs they are. I want you to examine the pictures that you're going to see on the upcoming slide. And then I want you to tell me or think about what you noticed. What could we say about each of these dogs? So, what similarities, what differences do we see? So let's move on to the next slide. So again, just take a look at these dogs. If you can't see them on this voiceover version of it, this last little guy down here in the corner, that's okay. Look at the other dogs. Just try to think of similarities, differences that you think of them, maybe jot them down on a piece of paper. And then let's do the same thing with these guys. So again, just write down things you see that are the same, things that are different, and then think about how these dogs are different or the same as the dogs on the first slide. So compare the first set of dogs to the second set. So the point of that was that while you're in nursing school, no, you may not be learning specifically about German Shepherd dogs or bulldogs, but we can learn about the characteristics of these dogs or the characteristics of our patients. With the dogs, we might have thought about colors. We might have thought about athleticism, how active these dogs are or not. We might have thought about training, what dogs seem more trainable than the others. And then family dynamics, which dogs seemed like family dogs and which dogs seemed more like protectors. So the point of all that was to kind of just ease you into the idea of conceptual learning. So this slide we're on now, it's really outlining the major learning objectives for this course. So for NSGA 140, we want you guys to exit this course having learned how to define clinical judgment, to understand the role of the registered nurse, explain evidence-based practice, grasp conceptual learning, including the Ivy Tech program concepts, and apply strategies to enhance their academic success throughout the course and the nursing program as a whole. Once we go past this slide, we're going to talk a little more in depth on the big concepts that you're going to learn in this course. These concepts are foundational, and you will encounter them over and over throughout the nursing program and your future nursing career. So again, your major course learning objectives are just kind of outlined here for you to make it easier for you to find. So one of the fundamental nursing concepts, nursing school concepts, is caring. Caring is focusing on empathy and emotional support for your coworkers, your patients' family members, other people that you encounter at the hospital or the other facilities where you might work. Nurses demonstrate caring through actions that comfort their patients, build trust and rapport, and also foster healing. Small gestures that you do or don't do can often have a significant impact on your patient's well-being and their recovery. So again, we've just got some little bullet points down here that are summarizing that idea of caring for you. Our next big concept is communication and collaboration. These are interrelated and key to delivering safe and effective care. Yes, you can have communication, but in nursing and in healthcare as a whole, you can't really have communication without collaboration. You are not on an island by yourself trying to take care of your patients. You are working very closely with various healthcare professionals, from doctors to CNAs, to physical therapists, to occupational therapists, to specialists, to whoever encounters that patient or client and does something to take care of them. So you have to be able to collaborate and communicate with them clearly. It's important to share clear information because that helps us to avoid errors, and it also provides coordinated treatment that improves patient outcomes. Clinical judgment is our next big topic, and it's actually going to be its whole own entire module in this course. Clinical judgment involves analyzing patient data and applying nursing knowledge to help you make timely decisions. So we don't want you to rush in what you're doing as a nurse, but you do need to have good time management and to be able to get things done in a reasonable amount of time. And clinical judgment helps you to do that. Clinical judgment helps you to recognize subtle changes in your patient's condition, which allows you to intervene, step in, and do something early to improve safety and care quality. So sometimes nurses are the first ones to notice when there's something wrong with our patients. We're with them for a lot longer during the day than the physicians and the advanced practice providers are. So sometimes we're the ones who notice, and we need to be able to clinically judge what's happening and what we should do to help our patients. So evidence and evidence-based practice are another big concept. You're going to see it throughout your nursing career, I promise you. Anywhere you work that has a safety or other type of protocol in place, any protocol basically in healthcare is going to be evidence-based. They're going to have looked at research studies. They may have done their own research study to determine why this is the best thing to do. And you really don't want to be that nurse or work somewhere where they do things because that's how we've always done it. You want to be somewhere that uses evidence-based practice because it's the safest and most up to date. So what evidence-based practice does is it integrates current research into clinical nursing. So it takes all that information that we've gathered from reputable sources and we develop it into ways that we actually practice as nurses. Evidence-based practice is also known as EBP. So EBP promotes interventions supported by scientific evidence. It ensures that care is effective, safe, and up to date with healthcare. So that's how you make sure your patients are getting the most up-to-date clinical care that they could possibly get. Another big concept is leadership. So leadership in nursing can involve, or does involve, guiding teams through challenges in routine care. You guys are in the RN program, the ASM program, so you are by default going to be a leader wherever you work. You will have someone who is, their license is below yours in rank of responsibility. So RNs are kind of the top, and then we have our LPNs that are just below us. They learn a lot of the same things we do in nursing school, but they don't learn exactly everything, and their responsibility level is just slightly lower than what an RN's is. And then even if you don't have LPNs where you work, your CNAs or techs or unlicensed assistive personnel, whatever they call them where you work, they're going to be below you definitely. So you're going to be responsible for making sure they get their work done as well as your own. They're also people that you can delegate to. So with that in mind, you should always remember that strong leaders will foster collaboration, maintain safety standards, and help resolve conflicts. So really, it's your job to make sure that everybody's communicating clearly and well, and that they're not, bickering with each other throughout their shift. Doing all this will help contribute to a positive patient outcome. If you're all getting along well, you don't have to be friends, but if you're getting along well and you're working together professionally, your patients are going to have a much more positive outcome in the end. Another big part of nursing is managing care. So, like we said in an earlier slide, you are not on an island by yourself. You are not taking care of these patients by yourself. So sometimes you have to be the hub that all the other information comes into the patient's sphere by. So you're going to make sure that the information you're getting from the primary physician is going along with what the pulmonologist or the lung doctor has told you. You want to make sure you've got the kidney or the renal doctor on board. You want to make sure that therapies are on board with whatever the plan of care is. As the nurse, it's your job to make sure that everybody is getting the same information about the same patient so that we can all work together to develop one plan of care. And that's what managing care means. That can also mean when your patients leave you and go somewhere else. So if you work on a med surg unit and your patient is upgrading to ICU because they're getting sicker, it's your job to make sure that that transition from lower level of care to higher level of care is one that's seamless and that all the pertinent information is shared and the patient doesn't get lost during that transition. Same thing if they leave you and they go back to their nursing home or they go to a rehab facility. So managing care really involves organizing and coordinating all aspects of a patient's treatment. The nurse ensures seamless communication between providers and efficient use of resources to meet comprehensive health needs. So you're not just trying to fix one problem your patient has, you're trying to make sure you keep them overall healthy. So you're really working on keeping them healthy as a whole. Professionalism. As nurses, we are professionals. So you really need to act ethically and responsibly at all times. You want to uphold your patient confidentiality. That's where like HIPAA comes in, and we're going to talk about that more in depth later. You want to demonstrate integrity. Integrity, the way my kids have learned it at school and at Taekwondo, is integrity is doing the right thing even when no one's watching. So the same thing goes with nursing. Do you open that pill for your patient and drop it on the floor and then give it to him because he didn't see you do it and no one else saw it? Or do you tell him, hey, I dropped this on the floor. I'm going to go throw this away and get you a fresh one? That's integrity. There can be more serious examples later that we'll probably get to, but that's a good one to start with. And you also want to make sure as a professional that you're following standards that nurture trust and respect in healthcare with your patients and with your coworkers. Always stand by what you say. If you tell them you're going to do something, do it. If you don't think you're going to be able to follow through on a promise, don't make that promise. Be honest with them. People are going to respond much better to honesty. Safety is a huge priority in healthcare. It's a big one for nursing. Nurses are held to a very high standard when it comes to safety for patients. So you definitely want to have that be a top priority for you when you are trying to protect your patients. The big ones that nurses are held responsible for are injuries and infections. So that's why we have protocols. We have protocols for hand hygiene. We have protocols for fall prevention. We have protocols for um, skin breakdown prevention. It's our job to make sure those protocols are followed by ourselves and by anyone who's working with us. And also, it's our job to educate our patients on why those things are in place and how they keep them safe. Technology and informatics is another big concept that we're going to discuss in detail in this class, but it's going to follow you. There is no aspect of nursing or healthcare that does not have technology and informatics in it. Technology and informatics streamline nursing care by providing accurate patient data. It helps aid decisions and it improves communication. So a good example of that is, say you were in the ER because you had a car accident. Your doctor, your primary care doctor in their clinic, can have access to all of the testing, all of the notes from your ER visit as soon as they're put in the chart. And that helps them when they call you the next day to see if you're doing well, or if maybe you need to have physical therapy because of something that happened in the accident. They already know everything that's done. They know why you were in the ER, what things were broken, what medicines they gave you, what the x-ray said. So it really just helps aid those decisions. And it's a form of communication. Technology and informatics also help to enhance patient monitoring education. So we can monitor our patients from unit to unit, from hospital to hospital, because all the information is shared electronically. And as far as education goes, we can document what they know and what they don't know, and that helps us to teach them what they really need to know to safely go home with a new diagnosis or a new medication or new exercises from therapy. And all of that helps to lead to better health outcomes for our patients. So as we move forward through the program, we're going to move away from these foundational concepts. They'll still be there. They don't ever go away. So they're foundational, which means they should stay with you throughout the program and your career. But we're going to start teaching you more concrete concepts. And those are going to be things like expected assessment findings. Sometimes people will call them normal, but we try to get away from that because normal doesn't really mean anything. Normal for me is not normal for you, which is not normal for your neighbor. But expected assessment findings and expected body functions, those are things that we can look for and find. You're going to be a much better prepared and more flexible nurse if you know what the normal expected findings are and what to do when you find the abnormal ones. So say you take my vital signs and instead of my heart rate being, in the 90s, it's 150. If you know what you should find and you find something different, then you can start to think about, okay, what can I do to fix this? What can I do to mitigate this weird thing that I found with my patient? Um, and that's just a lot more helpful for you than just memorizing what to do for specific occurrences or what individual medications do. So a good example of that is down here, like on our slide. It talks about, we may not teach you specifically about asthma and COPD, but we're going to teach you about oxygenation and the way the lungs work and what you should expect from them when you assess them. We may not teach you about urinary tract infections and kidney stones, but we're going to teach you about urinary elimination and the way our urinary system should be working. So in today's world, nursing education is focused more on teaching these core concepts like oxygenation and urinary elimination rather than the specific diseases. Again, this is going to give you foundational knowledge that you can apply to various conditions, promoting a deeper understanding of patient care and clinical reasoning. So when I was in nursing school, we memorized specific disorders, specific diseases, and specifically what to do for those things. But if you know that someone is not breathing the way you're expecting them to, and you know what those findings are telling you, you don't have to know that they have asthma. You don't have to know that they have COPD. You just know that they have some kind of airway restriction based off what you're finding in your assessment. And then you can put interventions in place without knowing that medical diagnosis. That's important in nursing because we don't necessarily need to medically diagnose our patients. We just need to know what our assessment is telling us is wrong so that we can try to fix it. Now we're to the end. So, to succeed in any environment where there's conceptual learning, you really need to learn how to look for patterns across the different concepts and to prioritize your critical thinking over just memorization. You need to learn how to ask questions such as why and how, because they deepen your understanding of the concept that you are learning. Creating concept maps can help you visualize the relationships between the ideas, making complex information more manageable and interconnected. So when you think back to the asthma and COPD, instead of trying to make a map for that, why don't we put oxygenation in the middle and then expected findings and abnormal findings? And then you can branch out from there as to what to do with each of those abnormals that you find. Or maybe why is it happening? If they're having airway restriction, what's causing it? Is it because there's a blockage, because there's mucus in there that's blocking it? Or is it restricted because the airways themselves are narrowing? So that's kind of how concept maps work for this. So again, just really, really try to just change your way of thinking. I know not everybody is familiar with or comfortable with conceptual learning, but if you can learn to apply it, you'll definitely be successful in nursing.